We would like to thank Professor Derrico for agreeing to be interviewed about the field of nursing for MDU 4003. Professor Derrico is a clinical nurse specialist in critical care nursing and has been certified in oncology nursing and has practiced experience in both adult and pediatric critical care, as well as adult and pediatric medical surgical nursing. Professor Derrico has expertise in legal nurse consulting and pathophysiology and health assessment. Professor Derrico teaches adult health nursing didactic and clinical classes to BSN, RN-BSN, and ABC students. The didactic courses taught include pathophysiology and health assessment, as well as medical surgical nursing. Professor Derrico has been honored with numerous undergraduate teaching awards, 3 College of Nursing Teacher of the Year awards, and 2 Teaching Improvement TIP awards. Professor Derrico received his BS in Music Education at Westchester State College and his BS in Nursing at the State University of New York. He received his MSN in Adult Critical Care Nursing at the University of Florida. So, Professor Derrico, what made you want to go into nursing over other health care professions?
Well, I joined the Navy when I was in my early 20s. And I was a hospital corpsman, and that is a medic nursing type of profession, and I really enjoyed that. And it was actually while I was in the Navy that I decided that doing patient care was what I wanted to do. I observed that physicians didn't have the same type of patient contact that I found to be rewarding and that I was interested in, and I liked the bedside aspects of nursing. And so when I left the Navy, it was absolutely clear that I wanted to go to nursing school and enter that profession.
That's awesome. And so if a student is deciding between a bachelor's in nursing versus a master's or doctorate, what should they consider when they are making their decision? Do certain levels of training lead to different types of jobs?
Well, entry into nursing can be from several different avenues. The 2 most common avenues is to either get an associate degree or a bachelor's degree. I think it's pretty widely recognized that getting a bachelor's degree opens the doors to a lot more opportunities, as well a deeper, broader education. There's also a few hospital-based diploma programs that are still in existence. So really your options for entry into the profession are bachelor's versus associate, and I think bachelor's is really the way to go because of the opportunities that follow. After you get your bachelor's degree, then there are advanced practice opportunities through either getting a master's degree, which is a clinical nurse specialist type program, or doctorate of nursing practice. And the doctorate of nursing practice is a relatively new degree that is actually considered to be a terminal degree in nursing, and it affords one both clinical experience as well as opportunities to contribute to the profession, either in teaching or through scholarly work. And I would say that master's degree programs are becoming less and less. Those are the popular ones when I went to graduate school, but there are less and less master's programs, and most people enter doctorate of nursing practice, which is considered to be a clinical doctorate. The other graduate option is a PhD, and those are most tailored for nurses that are interested in contributing to the profession in the area of research. But those are all options for advanced practice education.
Great, thank you. And so I noticed that you have specialized in a lot of areas of nursing. How did you go about choosing those specialties, and how flexible is the role of being an RN?
Well, I think getting your basic education, you come out being a generalist, and actually your bachelor's program that we have here at the University of Florida, we give you a taste of child health, a taste of maternity, a taste of mental health and community, but the bulk of your education is in adult medical surgical nursing. And I would say 70 to 80% of new graduates go into adult medical surgical nursing positions and as their first job, and then some people do end up working in specialties initially, but I think it's pretty common and customary for people to go to specialties after they hone their fundamental skills in an adult medical surgical area. I think that the taste of those areas may whet a person's interest for where they might want to go to work in the profession and specialize. Personally, when I was in the Navy, I worked in adult medical surgical nursing. So when I became a registered nurse, I just wanted to follow suit there. And after a couple of years, I developed an interest in critical care, and I worked in pediatric critical care. It was my choice to go into that area. And then I worked in adult critical care, and I got my master's in adult critical care. And so I think the experiences that I had as a nurse working in a medical surgical unit kind of caused me to have certain interest in certain areas.
Very cool. And then, Professor Derrico, what types of patients do you work with, and what are your day-to-day clinical responsibilities, those that you do have?
Well, currently I take students to a adult oncology unit. So that is a unit where cancer patients get chemotherapy mostly. And so when I take students to this area, then we take care of cancer patients that are either newly diagnosed with cancer or undergoing chemotherapy, or in some cases are in advanced stages. And we do everything from doing health assessment, which involves interviewing and listening to their lungs and assessing their belly and checking their pulses, to giving medications, providing teaching, doing dressing changes, interacting with doctors, being part of the healthcare team.
Great. And then, so you do a lot of things in nursing. What do you think are the best and worst parts of being a practicing nurse?
Well, I think the best part is being able to contribute to people's lives who have needs. And when people are ill, they're oftentimes thrown into the crisis of their life, and they need help, they need assistance, and it's a rare opportunity that nurses have to be right there in the middle of the crisis. And whether it's a happy time, such as having a baby, it's still a situational crisis because life is never going to be the same after that. Or you have a person who's having surgery, might be a relatively simple procedure such as an appendectomy where the appendix is removed, might be something more elaborate such as surgery for removal of a tumor or cancer, or taking care of patients who have serious illnesses. I think it's a rare opportunity to help people through those times, teach them how to take care of themselves, work with the families, those kinds of things.
It's definitely a great practice.
So those are I think the good things. And then you also asked what are
the worst.
The worst. I don't know that there's anything bad or worse, but I'd say that sometimes nursing is difficult. I'd say that the work is hard in that there's a lot of responsibility that nurses have, and so we have to be attentive and on our toes when we're caring for patients. There's a lot of responsibility to be good data collectors and make good observations and give medications safely, do procedures with wonderful technique, teach people the things that they need to do, And so that responsibility is a challenge. I think that the hours, nurses work different shifts. And so for some people, working the night shift is a challenge. Personally, I like working the night shift. It's maybe a little bit lower key, but then sleeping is difficult. And I think that as a nurse, you learn how to handle the stress and take care of yourself so you don't burn out. And so I'd say that those are some of the challenges of working as a nurse.
Absolutely. And then, Professor Derrico, have you had any experience in research in nursing? How would you advise students who are interested in research aspects of healthcare as opposed to clinical aspects to approach their educational opportunities? I know you spoke earlier about PhD route.
Well, personally, I had some experience in research when I was in graduate school.
Okay.
And I think that's the place where most students come into contact with research, either as consumers of research or actually finding new knowledge as researchers. I would say that students who have an interest in research need to consider the PhD route, where they would actually work with a nurse researcher here at the College of Nursing and develop a research program as a graduate student. I would say that for the clinical doctorate of the DNP master's types of programs, that you're more of a consumer of research, where you have great responsibility to know what we know about caring for people with certain problems and certain procedures, etc. And so I think no matter what your track is, you're involved with research, but it's really the PhD route where you're involved in generating new research and finding new knowledge.
Great, thank you. And I know a lot of students have expressed a passion for one day teaching healthcare to students who will be where these students are now. As the extraordinarily well-recognized professor that you are, can you give any advice to students who may one day pursue teaching roles? What educational path would maybe be best for them?
Well, I think in order to be a good teacher, you need to be a good nurse. And I think that goes for any profession. You can't really teach what you don't know personally. So generally, teaching nursing involves clinical teaching, where you actually take students into the hospital or into the community and you're actually providing care to patients. So you need to develop your own clinical skills and expertise. As well, teaching is all about communication, and so I think it starts with being a good teacher to patients and families, and then that generally transfers into teaching students clinically, and then classroom teaching is perhaps the most different part of the teaching role that nurses have, but certainly classroom teaching is an important skill that some nurse educators take advantage of. Currently at the College of Nursing, most every faculty does some clinical teaching, but only select faculty are in the classroom, and generally there are people who like to teach in the classroom or have those skills.
Great. And then you spoke a lot about communication, and that kind of follows into the next question. As a nurse, what are your daily interactions with physicians? How do you work with them in the treatment of your patients? And a lot of people in this class hope to one day be future physicians. Can you speak to the importance of collaborative care and what makes collaborative care work effectively?
Well, collaboration with physicians is in the fundamental skill set of nurses. That nurses are part of the healthcare team, just as are respiratory therapists, physical therapists, social workers, and then physicians. So generally the way things happen is the physicians will write orders and kind of leading the plan of care for the patients, and nurses as well as other professions are implementing those orders. And so we're interacting with physicians through the written word and reading and interpreting those orders, but then we're also reporting things to physicians on a daily basis. And we're taking part in rounds on patients. We're talking to physicians on the telephone. We're doing procedures with physicians, and I would say that interacting with physicians is in the daily skill set and agenda for delivering nursing care. Now, truth be told, it's nurses who are at the bedside, at least in the hospital, 24/7, and physicians are dependent upon nurses on making good observations and notifying them and documenting and communicating. And so we're constantly staying in touch with physicians and talking to them either in person or over the telephone or electronically in our entries into the electronic health record.
Yeah, so effective communication is definitely important there.
It's fundamental.
Yeah, absolutely. And then what changes in the field of nursing do you foresee coming in the future years? What's the kind of the future of nursing, I guess?
Well, I think that the use of the electronic health record, we're seeing that in doctors' offices, in clinics, in the hospital, as well as in the community. So computer skills, we're starting during undergraduate education for students to be comfortable with contributing electronic health record. And I think that is one definitive change that has happened in recent last couple years. I think the other change is that bachelor's prepared nurses are more and more going for advanced degrees, and whether it's a master's degree, a doctorate of nursing practice, or PhD, we see many more nurses getting advanced degrees. And those opportunities to work as an advanced practice nurse are also increasing. And so that's what I see. I see more and more nurses working in advanced practice roles.
Yeah, it's definitely a growing field. And then, do you have any closing comments or thoughts on topics we didn't cover for us?
Well, I think that anybody who's toying with going into a healthcare profession, I mean, this is the area to go in. I mean, there are jobs just about everywhere. And so I have a son who's in graduate school for music, and I wonder if he'll ever get a job. He's very talented, but there aren't jobs. And I have a daughter who's going to be a teacher, and I worry about the salary that she's going to get. I think there's more likelihood she's going to get a job in teaching. But you know, in healthcare, there are jobs almost everywhere. And the aging baby boomers, such as me, need healthcare providers. All that being said, nurses are the biggest group in that healthcare workforce, and there are an abundance of opportunities, either as a general practice nurse, advanced practice nurse, and so you are picking the absolute best profession. When there's things in the newspaper or in magazines, sometimes in the Sunday paper, talking about what are some of the biggest growing professions, professions with the best salary, the best opportunity for growth, nursing is always at the top or in the top 3. So I don't think you can go wrong. I remember many years ago when I might have heard that I have a degree in music. And I graduated with my bachelor's degree and I could not get a job. It was so frustrating and depressing. I went in the Navy, I became a hospital corpsman, and then I went to nursing school. And since then, it's been totally the opposite. It was my choice where to go to work. And it was my choice, because there's a nursing shortage, on picking out a specialty and going to graduate school. And so I think the opportunities, long story short, are abundant. So it's a good choice.
I agree. Thank you so much, Professor Derrico, for speaking with us today.
You're welcome.